To the Turn On Your Inner Light show. It's time to stop just surviving, and it's time to begin to thrive. It's time to live happier and healthier. Turn stress into strength. Noted author Debbie Mandel will show you how to move beyond personal doubts and fears and into positive perception to turn on your inner light. Here's your host, Debbie Mandel.
Greetings, everyone, and welcome to my show. Our guest expert is Dr. Albert Levy, MD, a fellow of the American Academy of Family Physicians, the New York Academy of Medicine, and the Royal Society of Medicine in UK, a professor of medicine at Mount Sinai School of Medicine in New York. He holds a diploma in clinical homeopathy and is the founder of Manhattan Family Practice located on Park Avenue and 80th Street in New York City. Welcome, Dr. Albert Levy.
Thanks, Debbie. Thanks for having me. Hi, everyone.
Now, I would like to know, are we still in the midst of the flu season, and what kind of season are we having this year comparable to other years?
I think this year is much blander. And I believe one of the reasons is that most people that I know, at least in my practice, have taken the flu shot. That's one fantastic and amazing measure that everyone should have done or should do if it's still available at your doctor or pharmacy. The other thing is that we had a very mild winter so far, so those things have avoided most people having the flu. And I believe a third one would be that we don't have the anxiety, the angst that we had like a couple of years ago with the H1N1 flu, so there is no panic around it. So I believe people are well aware that they don't have to panic when they are sick. And maybe there's a fourth one, which is what I think you would like to talk about, which is the difference between the flu and the cold.
Oh, you read my mind. But before that, I'm going to tell you something very interesting. I have never had a flu shot in my life. Mm-hmm. And my radio engineer, Tom Ross, has never had a flu shot. He's allergic.
To eggs?
Yes. So what do you do?
When you have an allergy to the flu vaccine? Mm-hmm. Well, I don't think you should take it if you actually have the allergy. I must say, however, that many people, when they don't feel well, they feel run down, they feel under the weather, then they want to go to the doctor and have a flu shot. And that's the wrong thing to do, because when you are down, it means that you may be getting the flu. You are already in the incubation period to have the flu. And if you have the flu shot when you have it, it will not prevent to have the flu, the disease in itself. You will have it. It will be milder than the real flu, but you're going to think that it is a side effect or an allergic reaction to the flu shot when it's not. So we have to establish if indeed the patient has an allergy, or it is simply that they took the flu shot when they were when it was not indicated. But if you do have a real allergy to the flu shot, you should not take it. And I would recommend then alternative medicines if you are prone to have the flu. Since you obviously never had it.
I never had the flu.
So you probably don't need anything. You're probably a very healthy person with, good diet, exercise,
yeah.
Good spirits, happy person. To be happy, to be content, it's a very, very important thing to prevent these viruses to catch us.
Yes, so we don't unleash an inflammatory response in the body.
Exactly.
And then once you're out of balance, then we have trouble. So let me ask you, as you were posing the question, how do I distinguish the flu from a bad cold? And do I need to if my cold is bad?
Okay, well, a common cold, as we call it, is a benign self-limited syndrome. It's a group of diseases. There are several families of viruses. It's, I must say, the most frequent acute illness in the United States. So we see, everyone I know would have had a common cold in their lifetime. A child up to, say, 1 year old would have 6 to 8 common colds a year. So, which is sneezing, nasal congestion, some discharge from the nose, sometimes a cough, low-grade fever. When you were little bigger, you can say you have a headache and a sore throat and malaise. Those are the very common things. They're different than the flu. The flu is when, first of all, it comes in outbreaks. So when you have, or you know someone who's been in contact with someone with the flu, you may catch it. And that's a big thing, because influenza, which is a different type of respiratory illness, it's caused by influenza A and B, for example, and H1N1. And some years are different ones, and that's why the flu shot is different every year, because it's based on different viruses. Not all are possible to make out a flu vaccine, but they do differ. And the influenza, or the flu, when we say, it's much more dangerous than a common cold, because the major complication of the influenza or the flu is pneumonia. And that is more frequent, not very frequent, but is more frequent in patients with any underlying chronic disease, such as those who have diabetes, those who have HIV infection, or those that have any chronic asthma, for example. Those are at risk to catch the flu and to end up with pneumonia. And the flu, you're really sick. You're in bed, you're the high fever, your body aches, you have chills, you really don't feel well at all. Your appetite is gone. And a cold, you think, oh, I have a cold, you're sneezing, you have a runny nose, you can go to work. When you have a flu, you don't go to work because you feel very, very unwell. That's a basic difference between one and the other.
Now, let me ask you this question. There's a flu outbreak. Okay, 'tis the season. Mm-hmm. So here I am, I'm going to the mall, I'm going to movies, maybe I have to get on a plane. Everyone around me is coughing and sneezing. Mm-hmm. Do I have any way to protect myself? If it were my child, I probably would avoid groups of people during an epidemic and keep that child with a sterile mask on. Mm-hmm, mm-hmm. But what can I do? Or is it just, it's the luck of the roses?
Well, there's nothing really proven that will make it as a prevention for...
Well, let's hold that thought for a moment, because it's a big question. We're going to go to commercial break, and we will return with Dr. Albert Levy. He's the founder of Manhattan Family Practice, located on Park Avenue and 80th Street in New York City.
Now you can take Debbie Mandel home with you. Her book, Turn On Your Inner Light, Fitness for Body, Mind, and Soul, will help you decompress with healthy, positive, concrete solutions. Common life challenges are presented so that you can quickly find the help you need. Emotional tips, original meditations, and a fun and easy-to-follow fitness workout for each mindset. This revolutionary new method will help you rewire mind and body to take back your power. Get it on Amazon.
Are you overwhelmed with the burden of taking care of children, parents, or both? Are you taking care of everyone else except yourself? It's time to change your habits and re-energize. Debbie Mandel gives you an innovative and easy-to-follow program for good health and happiness. In her magical new book, Changing Habits, The Caregiver's Total Workout, Debbie Mandel shows you step-by-step how to find the optimal balance between giving and receiving, and guides you to exercise and eat right to take care of yourself. What are you waiting for? Read Changing Habits and start training for your life. Life does not need to be a burden. Get Changing Habits, The Caregiver's Total Workout, on Amazon.
You're listening to the Turn On Your Inner Light show. I'm your host, Debbie Mandel, and I'm speaking with Dr. Albert Levy, and he's a professor of medicine at Mount Sinai School of Medicine in New York. All right, so before commercial break, you were going to tell us what options we have when the flu epidemic is raging and we're in crowded situations.
Mm-hmm. Well, probably we should not be in crowded situations, but we can't avoid it, can we? When we are, as you said, in malls or even in subways and people sneeze around us. And so one thing I would say, for those that are already stricken by the flu, they should stay home. Do not go out and about working or in school or anywhere, or malls, anywhere. Just stay home. You will be doing a service to yourself and to your neighbor, not contaminating anyone. But there are very few things that really are proven to work. I mean, it used to be, it's fashion. In medicine, there's fashion. We had the time for zinc to prevent, and it came out that we're not sure that it works. And sometimes some of the zinc preparations give a lack of a smell, so we can lose that and for forever. So this is not something to take lightly. Vitamin C, we know it may not work, and it's very difficult to say, but it used to be a very common thing years and years ago. Echinacea is another thing that doesn't work, and yet people spend a lot of money buying these products, and it doesn't work to prevent it. Some alternative medicines are interesting. It's not a prevention, really. It's more when you already have either the flu or cold symptoms, then you go for a different treatment. To prevent something, first you have to be well. The best way to be well is to feel well, is to have a good life. And to have a good life, a lot of it is up to you. It's not only the diet, balance that, and exercise, like we all say, but it's a little bit of happiness. Is to be content. Is to be, to be helpful to other people. And those things make you feel better. And I can assure you, Debbie, when I see patients who are anxious, unhappy, they're angry, those people, they're depressed, those people are sick, they become sick. Of course, if you smoke, it's a disaster. You know that if you have a cold, for example, a cold may last a week and a half. Well, notoriously, if you smoke and you have a cold, it will last 3 days more than the non-smoker. So this is already a lesson. If you're listening and you're smoking, think about quitting. That's one thing that would prevent many problems, many office visits, in fact. So plenty of liquids. Liquids doesn't mean alcohol. It means good hydration with good green tea or white tea and water, plain water. That's the best thing you can do. And rest, of course.
What about chicken soup?
Chicken soup is very good, actually. We don't know what it is in the chicken soup. There is a substance that is not known, but chicken soup is known for centuries, thousands of years, to help to control or prevent colds and even the flu. And we don't know what it is that is in the chicken soup. But you're absolutely right. It's something we all know. The tea, the chicken soup, the rest, take it easy. Think about positive things in life, and you're getting out of it much better than if you're down.
Is there anything I could do to bolster my immune system? Is there anything I could take homeopathically that could help?
Well, not really. It's not proven that something homeopathic will boost your immunity. It's true that if you do have the beginning of the flu, then there is a product you can use, which is quite familiar to most of your listeners, I'm sure, which is a long name, oscillococcinum, and shortened for Oscillo, and is found in most pharmacies and is over the counter, actually. And I do take that as soon as I have the flu. What it shows is that it will reduce the severity of the flu, and it may shorten the duration of it. And that obviously is much better to take it and be sick for 2-3 days instead of 7 days in bed. And it's called oscillococcinum. I do take it between you and I and the rest of your listeners. I take it when I fly, for example, and I know that there is a flu outbreak. I would take one of these oscillococcinum once a week to prevent it. But that's not generalizing to everyone, and it's not also an indication to do that. But I know of people that do that, and they do prevent the flu. Although the oscillococcinum is proven to reduce the severity and the duration of the flu. It's not for a common cold. For common cold, there are other things that I like to use in homeopathy. I don't know, would you like me to elaborate on this?
Yes, of course. No, yeah. We don't. We want it told. Reveal it.
Well, you see, there is allopathic medicine, which is the regular medicines that we know, and there are alternative medicines which can help. And homeopathy is one of the modalities of medicine where it will treat the symptoms and is very inexpensive, is over the counter, doesn't have any side effects at all, and it does not give you any cross-reaction with other medicines. So I think it's a very good thing to be able to go to the local pharmacy and get something homeopathic for you or your child. In fact, you can give it to a child, to a pregnant patient, a patient, or to an elderly person. So there are some things like, for example, for the cold, there's something called cold calm. That's for people that are sneezing, runny nose, nasal congestion, and a minor sore throat. Then they have these chest syrup, which is a syrup, common syrup. The only thing is that it's made with honey, so diabetics should avoid taking that unless they speak to their doctors.
And that makes sense to me because honey's a potent antibacterial as well.
Exactly.
But we're going to go to commercial break. I don't want to rush this and return with Dr. Albert Levy. Dear listeners, I'm excited to tell you about my new book, Addicted to Stress. This is a message you need to hear. Are you addicted to stress? Do you do it all while everyone depends on you? Where's all this pressure coming from? It is coming from inside you. This is why my publisher, John Wiley, asked me to write Addicted to Stress, a woman's 7-step program to reclaim joy and spontaneity in life. This fun-to-read book teaches proven strategies to reclaim your life, silence your inner critic, build a healthy body, and reframe your thoughts to change your life for the better. Dare to be happy without the guilt. Addicted to Stress is easy to get. It's available at Barnes & Noble and other fine bookstores everywhere. You can also buy it at Amazon and other online retailers. We're back with Dr. Albert Levy of the Manhattan Family Practice, located on Park Avenue and 80th Street in New York City. We were, before commercial break, you were telling us about a cough syrup that incorporated honey, and you warned diabetics not to use it.
Unless they speak to their doctor, of course.
Mm-hmm. And what is it called?
It's called Chestal, like a chest,
mm-hmm.
with A-L at the end, Chestal. And it's good for children and adults. It's soothing, it works, and it doesn't have these bad side effects of the antihistamines. You know, it used to be that when you until today, many people they take antihistamines, and they feel worse with the antihistamine than with the cold, because the antihistamine will make you sleepy and you feel lethargic, and it's not worth it.
Sometimes it dries out a cough, and I know that if you went into the, pharmacy and you would see all the varieties of, let's say, Robitussin,
mm-hmm.
It's confusing, and many of them have alcohol anyway.
Absolutely.
I know that I don't even take Advil if I get a twinge of a headache, because I'm going to get a rebound effect. I feel out of body. I don't take medications. What I will do is I say, well, what's out of balance? Let me go relax, close my eyes, or take a walk, and there we're done.
Mm-hmm. Yes, well, that's probably because you are basically healthy. And I do think that if you have a positive attitude, you will use less and less medicines, and you go less and less to the doctor for simple colds, and even for the flu. You don't need to go to the doctor for flu.
Oh, you don't? That's an interesting.
For the flu, you stay home. You can phone your doctor and see if he or she can help you. It is true that depending on what you tell the doctor about your symptoms, he may want you either go to your home, if that's one thing you do in your neighborhood, that the doctor does house calls, or you don't have to go to the office, and he will make sure that you don't have a pneumonia or something else. But over the phone or by internet, if the doctor knows you and you're a regular patient, he or she can usually take care of that and tell you what to do. As you know, that's known medicine that was stocked for the H1N1, the Tamiflu.
Yes,
it's apparently not working well, and they say that the studies were not conclusive after all, and so there are very few things we can take except what we mentioned before, and try to take anything and everything that we see in the pharmacy counters is a bit ridiculous, expensive, and total waste. And it's true that if you have an antihistamine, it may alleviate the runny nose and the sneezing, but the side effects such as sedation, you really feel like sleepy, and drying of the eyes, nose, and mouth is totally limiting the use of antihistamine. This is not to mention that in older men, they may have a negative impact on the prostate. So it is, and now we don't give it anymore in children. So there are so many medicines that are out the window because we find that the side effects are worse than the disease. A cold is a cold. It's a virus. Will go away with or without anything.
Right. And what would you do if someone were running an uncomfortable fever?
Well, that's a very good question. Again, if it's a child, for example, and I have two grandnephew and niece here in New York who the mother calls me every 5 minutes when they have a fever, and that's not infrequent. And I tell them to keep a homeopathic medicine at home, which is called belladonna, and this is for high fever and headache in children. It's totally with no side effect. And if that doesn't work after a few little pellets of the belladonna, then, which is over the counter also and very inexpensive, so if that doesn't work, then they can go to the Tylenol or the Advil that you mentioned, in whatever brand it is. So that can and should work very well. That's for fever. If it's an infant or a newborn with fever, is something different.
Well, that could be very dangerous.
That could be dangerous. Yeah, the extremes of life, like a newborn and someone who is very elderly, then those have to go to the doctor or call the doctor, because that could be something. An infant, meaning from, say, 30 days to a year of age, with a fever, you have to contact your doctor, because it could be a million different things.
Yes.
Until you reach a doctor and you have this belladonna at home, it costs very little to give it to the child, and it's not a big deal, and the fever may come down, and you will be reassured, and you have time to talk to your doctor.
Well, this has been very, very helpful. I learned a lot, and I know my listeners have. Our time together has flown, and be well.
There you are. Thanks very much for having me on your show.
A pleasure. Affirmation of the week. The butterfly experiences only one metamorphosis, while humans can have many. And now for the latest medical trends. Only 20% of the 2/3 of Americans who report being on a diet will be successful. Underestimating calories and portions, overestimating exercise, skipping meals, lack of sleep are the top 4 reasons why people who diet do not lose weight. This is according to the Loyola University Health System. Green tea lowers cholesterol, according to 20 studies. And in a study by the Food and Drug Administration, they found that 400 lipsticks on the market tested positive for lead. However, they claim the lead found is at a low enough level to not cause a serious health risk. Well, I would be careful about kissing children while wearing lipstick or letting children play with a lipstick, because they are very susceptible to lead and the host of learning disabilities that unleashes. Adolescents who are internet addicts may also be at an increased risk of substance abuse, according to the Journal of Addiction Medicine. And children with inflammatory bowel disease may have difficulty functioning in school, particularly because their tendency is to internalize problems, and that can impact their attendance. These are findings from a nationwide children's hospital study which appears in the Journal of Developmental and Behavioral Pediatrics. Well, we come to the close of another show. I have an educational website, totally free, turnonyourinnerlight.com. And all the radio shows with the guest experts are archived for your listening pleasure at turnonyourinnerlight.com. In fact, they're on YouTube for you to access directly and very easily. Just look for Debbie Mandel Radio Show. Subscribe to my free newsletter on turnonyourinnerlight.com, and you will get the latest shows alerted and emailed to you, a fresh new article on stress management, and all the health tips fully delineated for you to look over and analyze or send to a friend from turnonyourinnerlight.com. Have a wonderful week and see you on the radio.